is Dakota Rose McRunnan, and today I will be examining and discussing the Glenorrhea and Tabletop Community Case Study provided to me in Unit Health 102 Assessment 2. In this case study, I will be discussing what guidance a social worker could provide by financially assisting them through rehabilitation, the inter-hospital transfer and counselling services available not only to Jason and Richard, but his family too, and how they are able to adapt to the circumstances provided, and also the availability of those services. So what access they have to them, considering they're in a rural and remote area. The guidance that the AASW Code of Ethics could assist me in is how to approach Jason and Richard's family throughout the duration of his rehabilitation and counselling. As seen in the Code of Ethics, you must provide the appropriate services to the family, and whilst doing that, treating the family with human decency and respect. And by demonstrating an understanding, you can show respect for the family's rights and responsibilities. Some inappropriate responses here throughout the case study could involve the social worker becoming agitated with the family's response to the social worker's help. Another unethical response could consist of the social worker not putting in the right amount of effort to help with the rehabilitation of Jason. And if the social worker doesn't take into consideration their community and their rural upbringing, it can potentially drive a wedge between both the family and social worker, causing the social worker not to help assist the family at their best. So, as seen in the Clifford D. and Berg AASW Code of Ethics, there are many different ways you could approach the family whilst still covering all aspects of dignity and understanding of their situation, making sure you're still taking into account the beliefs and disabilities, but still obtaining an appropriate behaviour towards both the social worker and the family. Essentially, the Code of Ethics is a great guidance for you to help understand what aspects to cover in respect for a client and their family, and what boundaries you cannot overstep between them. What might not be working well throughout this case study could be the communication between both hospitals and the family, because the family has minimal information of the finances between who is covering what and the accessibility to beds in the hospital. And the agencies like NDIS are not accepting Jason's case either, which is putting more strain onto the family financially. But the relationship between both hospitals, the family and the social worker are very incoherent, which is why the social worker is copying all the backlash from the lack of communication. But what is benefiting is the progress of Jason and how he is beginning to accept his new lifestyle. It may take some time, but he is evidently beginning to talk again and create an understanding of some basic knowledge, and just understanding that he will not be able to do the same things he was able to do before the accident. Throughout the case study, you can see that teamwork has not been used effectively. From Jason and his family, they have been misled throughout the entire process due to the lack of communication and teamwork used throughout the practice field, which is impacting the case severely. It shows a lack of professionalism with both the hospitals and reflects poorly on the social worker. Interprofessional practice is a vital role played in the prescribed case study, and it demonstrates what issues can be displayed from a lack of teamwork portrayed throughout the case study. Watson, Heatley, Galloy and Krusk 2015 state that communication problems are the second most complained about throughout the field, according to the Queensland Quality and Complaints. The way that you would approach the family in a professional manner all depends on how you would address them with their concerns. For example, the tone you would have with them, listening thoroughly with what they have to say, and being open to help them with any of their concerns. By trying to have an understanding of why they are mad can also show them that you're willing to push yourself to help them with any issues arising. Also, with yourself, you would try to overcome the fear of addressing the situation face to face with the hospital's manager and sort out the issue and discuss the lack of communication with the family and what is going to happen with Jason, if they're going to make the bed availability more accessible for Jason instead of having to travel so far for treatment, or make them travel weekly for treatment, and what services they could provide to stop them having to travel and pay all these expenses. I believe the skills I would need to develop as a social worker in this case study would consist of communication skills between both the hospital manager, NDIS, Jason, and his family. The more communication, the more knowledge that they have, and the easier it can be to help set up not only themselves on track as to figuring out expenses, travel time, and the process of rehab, but also giving me a network to follow with it all. Address the matter of financial issues and help set Jason up with the workers' compensation, or the state insurance regulatory authority, and his green slip CTP, which should be prioritised first financially before you begin the process with NDIS. My strengths that would be shown throughout the case study would consist of my communication skills and being able to gather information as soon as I could. Another skill set could consist of being able to obtain reliable resources to help with the recovery, even if it consisted of what shopping centre would be best suitable in a rural and remote area that has the best accessible wheelchair entrances. But my limitations would sadly consist of being able to provide the entire family with reassurance that Jason would be the same person he was before the accident, and he would have a good financial stability. Jason may not be eager to start counselling, so there's only so much a social worker could do to encourage them to seek advice and help from a professional manner. My preferred career pathway would definitely consist of working in psych ward at a hospital. In psych ward, you would need a lot of knowledge on a patient and how to approach a dangerous situation accordingly. But if a certain circumstance is too dangerous and could put myself at risk, then I would have to put up some boundaries and limitations as to what I can help and what I can provide for a patient. By studying this field, it can help increase my knowledge on different ways I could approach a situation if a patient becomes reluctant to assistance, and can show me when it becomes too unsafe to help them. So in conclusion to this case study, the effectiveness of communication and ambition can help not only social workers, but hospital managers, nurses, doctors, families, and patients have more of a positive outcome and a quicker road to recovery for a new changed lifestyle.